My name is Mackenzie Barnes. I'm going to be working with the scapula first. So elevation would be considered going up. This would be scapular elevation, like shrugging your shoulders. And then scapular depression would be going back down and depressing your shoulders. I'm going to be showing you abduction and adduction. Scapular abduction with a B is going to be when you bring your shoulders forward, like so. You're bringing your shoulders forward, and you are moving your scapula away from the midline. Now, adduction with two D's, from here, if you're abducted already, you're going to bring those shoulder blades back. So this is going to be scapular adduction. Upward rotation, scapular upward rotation is if you raise your arms above your head. Scapular downward rotation is if you bring them back down. So for posterior tilt of the scapula, if you want to just raise your arm up, it is now posterior. This is scapular posterior tilt. So for shoulder flexion, that's going to be raising your arms above your head. That's shoulder flexion. And then for shoulder extension, it is bringing your arms backwards. This is shoulder extension. So shoulder abduction is when you bring your arm straight out to the side and up a little bit. This is shoulder abduction. Shoulder adduction is when you bring it across your body. This is shoulder adduction. So internal rotation, you start with your hand out and you rotate in towards the medial section, the midline, sorry. And for external rotation, you start medially and go out laterally. That is external rotation of the shoulder and internal rotation of the shoulder. You're going to be starting towards the midline with your arm about right here, just like this. And you're going to take it and move it away from the chest. This is going to be horizontal abduction of the shoulder. Now moving it towards the chest, so starting out, moving in is horizontal adduction of the shoulder. So diagonal adduction is just going, instead of going straight to the front or straight to the side, you're going to go at a diagonal away from the midline of the body. For horizontal adduction, you're going to go across the midline of the body, but towards the midline. So out is abduction of the shoulder, across and in is adduction of the shoulder. So for elbow flexion, you start with your anatomical position, so with your arms straight out. For flexion, you're going to just bend the arms up. This is called elbow flexion. For extension, you start up and then you're going to extend your arm down back to anatomical position. And then this is called elbow extension. Next, we're going to talk about elbow pronation and elbow supination. So elbow pronation is taking your hands from anatomical position and rotating them over. This is pronation. Supination is from going like this back to anatomical position. That is supination of the elbow. So supination of the elbow, pronation of the elbow. Okay, so in this video, I'm going to be demonstrating wrist flexion and extension, and then wrist adduction and wrist abduction. So from anatomical position, wrist flexion would be like this. Wrist extension would be going down and extending the hand. Then wrist adduction would be going in towards the body. This is ulnar deviation, so this is ulnar deviation, as well as wrist adduction. Wrist abduction is going outwards, wrist adduction, or radial deviation. Next, I'm going to be showing you flexion of the fingers and thumb, which is also called opposition. And then I'll also be showing you extensions of the finger and thumb, which would be called reposition. So from anatomical position, flexion of the fingers and thumb would just be like you're grasping something. So you go from out to in. That's flexion of the wrist and or the fingers and thumbs, also called opposition. All right, so extension of the fingers and thumb, or called reposition, is just when if you go from a curled position to opening. So you just open the fingers or extend them. So this is called extension of the fingers and thumb or reposition. Okay, next I'm going to be showing you adduction and abduction of the metacarpophalangeal joints. So from here, adduction would be squeezing your fingers together. So adduction of the metacarpophalangeal joints and the thumb would be bringing your fingers together. And then abduction of the metacarpophalangeal joints and the thumb is when you spread your fingers wide, just like that. So adduction, abduction. All right, in this video, I'm going to be going over flexion and extension of your hips, hip girdle. So for flexion, you bring your leg up, which is flexing that hip. So this is hip flexion. Hip extension is bringing that leg backwards. So that would be considered hip extension. Next, we have adduction and abduction of the hip girdle. So adduction would be crossing over, bringing that leg across the midline. This would be hip adduction. Hip abduction is bringing it farther away from the midline or bringing it straight out. All right, next I'm going to be doing external and internal rotation of the hip. So I'm going to demonstrate it here on my right leg. So what you do is you basically turn your foot out or in. So for external rotation, you're going to be going outwards, away from the midline. So you're going to turn your foot out. So it almost looks like you're standing like this, but when you have it straight, it's turned, your knee is turned facing out. And for internal rotation, you go from anatomical position and you bring that foot inward. So this is internal rotation from anatomical position. This is external rotation of that hip. Next, I'm going to be demonstrating diagonal adduction and diagonal abduction of the hip. So diagonal adduction is similar to regular adduction. It goes across the midline, but it's at a diagonal. So this is more of like if you're kicking a ball, how you follow through with it. So it's just at an angle. So this right here would be considered diagonal adduction. So similar for diagonal abduction, it's going to be away. So it's going to be away from the hip, but backwards more at an angle. So this would be considered diagonal abduction. All right, next I'm going to be demonstrating anterior and posterior pelvic rotation. So I'll demonstrate it like this on the side. So anterior pelvic rotation would be curving that spine a little bit, sticking that hip backwards, like you're almost going to sit into a chair. And then internal or posterior rotation of the pelvic girdle would be bringing those hips forward. So this would be anterior of the anterior pelvic rotation. This would be considered posterior pelvic rotation. So from the side, I'm in anatomical position. In order to flex your knee, it's going to be bent. So this is knee flexion. Knee extension is just when you have your foot flat on the ground and your knee is fully extended and straight. This is knee extension. If we have your knee flexed, this would be considered knee internal rotation, bringing that foot inwards towards the midline. And then external rotation of the knee would be bringing that foot outwards. All right, so next I'm going to be demonstrating from a seated position. I'm going to be demonstrating dorsiflexion, plantar flexion, eversion, inversion, toe flexion, toe extension, pronation, and supination. This would be considered plantar flexion. Plantar flexion. This would be considered dorsiflexion of the ankle. So plantar flexion of the ankle, dorsiflexion of the ankle. Then you have flexion of the toes, extension of the toes on the ankle. And then you have pronation. I'll stand up for this one. You have pronation, which is kind of how I used to stand when I was little. Pronation. And then supination, when you turn those feet inwards. So this one does it better. So this one, supination. So pronation, supination. So for spinal flexion, you have your hands flat on the ground, you have your head tucked under, and you're just raising your spine to the sky. So this would be considered spinal flexion. Now spinal extension would be pushing that stomach all the way to the ground and lowering those shoulders, pushing those shoulders back. So this would be spinal extension, and this would be spinal flexion. Okay, in this next video I'm going to be demonstrating lumbar flexion and lumbar extension / hyperextension. So from the side, we're going to demonstrate from the side. For lumbar flexion, you're going to be curving forward. So this would be considered lumbar flexion. And lumbar extension / hyperextension. So this would be extension, and then going further back would be considered hyperextension of the lumbar spine. All right, in this next one, I'm going to be doing lumbar lateral flexion to the right. So put your arm in your hand and lean towards your right, and this way you are flexing this side. So this would be lateral lumbar flexion to the right. All right, and then next I'm going to be doing lumbar rotation to the right. So lumbar rotation to the right would just be rotating the top of your body, your trunk, to the right without moving your hips. So this would be lateral rotation to the right of the lumbar.